Okay, so whenever you're ready.
All right. Welcome to Windermere's Cocktails and Conversations speaker series. We're honored to have Dr. Cyndi Yag-Howard with us today. Dr. Yag-Howard is a nationally known and award-winning dermatologist with over 20 years of experience specializing in the art of facial sculpting and aesthetic enhancement. She's also earned the national recognition of her dermatology colleagues by being elected to the board of directors of the American Academy of Dermatology, as well as being appointed chair of the Dermatology Section Council that represents the dermatologists and their patients across the country at the American Medical Association. Dr. Yag-Howard's practice is located in Naples on Goodlet Frank Road, which is where she sees her patients, and she's been gracious enough to give time out of her busy schedule to come and speak to us today about reversing the effects of aging. Dr. Yag-Howard?
Thank you very much for that kind introduction. As you said, my name is Dr. Cyndi Yag-Howard, and I've been in practice in Naples, Florida for 23 years now. And over that time period, I've had the opportunity to experience the art of facial sculpting and aesthetic enhancements. So today we're going to talk about non-surgical approaches to aesthetic enhancements. And that begins with a good, healthy lifestyle, a good diet, exercise, and at-home remedies that can help your skin. You do that on a daily basis, and then intermittently you come in for treatments, and that's the way we can really achieve a nice aesthetic enhancement. Today we're going to really talk about mainly the in-office medical spa treatments, facial sculpting, and light-based therapies. What we're not going to be discussing today are surgical treatments, because there's so many things we can do without any surgical intervention. We're not going to talk about body contouring, and we're not going to talk about skin tightening, primarily because I really don't think we're there yet. In my experience, I don't feel like the skin tightening opportunities we have are as good as they will be in the very near future. So let's talk about what happens when you mature. We actually all have a layer of subcutaneous fat, which is fat that resides underneath the dermis. And over time, that fat starts to dissipate and go away. We lose the tone of our muscles in our face. And believe it or not, we actually experience skull shrinking. So over time, your skull shrinks, your jaw recedes, your eye sockets get bigger and bigger. And that's what, as Angelina Jolie shows us, makes that more prominent. So you can see she looks nice and youthful in this picture. As she matures, she loses some of that subcutaneous fat. But another important thing that's happening, which I feel is one of the keys to excellent aesthetic enhancement, is we have fat pads right in this area. And over time, those fat pads collapse and they fall down into this area, which makes this more prominent. You get a little kind of bulge there, which makes this line more obvious. And that's the line that most people complain about when they come in. When I say what bothers you the most, it's almost invariably this line right here that people say, I don't like that line. Well, interestingly, when facial fillers first came out, that was where they were FDA approved to be used. Everybody wanted to fill in this line. It's the melolabial sulcus, or the laugh line. What happens is, though, if you just fill in that line, it doesn't give you a natural appearance because your face becomes flat. It gives you a flattened appearance, and even children have an indentation in there. What makes us beautiful is the way the light reflects off of our skin. And as you can see, as the light reflects off of Angelina Jolie's skin in here, this indentation has become more prominent. She's obviously still a beautiful woman, but you can tell she's older here than she is here. And that's largely because of the sinking and shrinking of that fat pad that makes that more prominent. But the key is this area. In my mind, that's the sweet spot, the cherry of the cheek. Because if you fill in this area, it makes all the difference in the world. You basically pretend like you have that fat pad back up there. It's one of the reasons why when somebody smiles, they look better. The reason they look better is because we artificially bring that fat pad back up here, and it makes it look more youthful. So let's examine this in a real patient. This is a before picture and an after picture in one of my patients who kindly let us use these photos. And as you can see, she looks better in the after picture because she looks more rested. She looks more, she looks like she feels better. She looks healthier. But why is that the case? Well, let's examine it. I've duplicated her before picture here and her after picture here. On a very elemental level, we're going to go to straight science. On a very elemental level, when you look at a human face, you're not looking at all of the details of the face. You're looking at lines and shapes and the way they relate to each other. This is a matter of survival from millennia ago. We've actually trained our brains to survive. And so survival relies on pattern recognition. That's what we do when we look at a person's face. We see shapes and we see lines. Now we're looking for patterns too. So what is the pattern we're seeing? Here we see, it's very easy to recognize, a parallel pattern. That is because of the way the light reflects off of the curvature of her face. So when people say this is what bothers them the most, our eye sees this. Our eye sees that depression that's caused by that dropping of those fat pads, and our eye sees a sad eye. But when we fill in that area, as we have over here, the light now reflects off of her zygomatic arch or her cheekbone, which gives her a happier eye, a happier smile, and a more well-defined jawline. Now, you really, if this is what you're really seeing on an elemental level, your subconscious is seeing that. Let's look at what happens when we remove her face. How do you think your pleasure center in your mind is going to receive both of those faces? That's what your mind sees. That's what you see, but that is what your pleasure center in your mind is actually seeing. So we can really very easily manipulate what your mind sees and make you go from a more tired, angry look to a very happy, rested look. And that's the art of facial sculpting. So what is facial sculpting? It's using fillers and neuromodulators or neurotoxins to actually sculpt the human face and give it a more rested and pleasant appearance. When you go to somebody to have one of these procedures done, please make sure that you go to somebody who has the credentials to do what they're saying they have the credentials to do. Many times in my practice, I've had to treat patients who were treated by people who didn't have the credentials and didn't know the anatomy, which is why I put this picture up here. This is the skull, right above it, all of your muscles and your vessels. And you can see that if a complication is going to occur, it's probably going to be occurring because the person who's injecting doesn't know exactly that anatomy. It's very important. And that's when you run into side effects and problems. So there are many fillers available. When I first started out, the only filler available was collagen. Collagen had its own problems. Collagen you had to be allergy tested to. No longer is that the case with the fillers that we usually use. The only filler that does require allergy testing now is Bellafill. I'm not a fan of Bellafill, nothing against the company or who makes it, but personally I don't use it in my practice. It's got collagen in it and it also has plastic in it. So it's the one that you will hear has a 5-year duration. But to me that if it's not placed correctly, if there's a complication, then you have a real long-term problem to deal with. So I just don't have that in my practice, but some people use it and love it. What we're going to talk about mainly today are the hyaluronic acid, the calcium hydroxylacetate, and the polylactic acid fillers. All of them very, very safe. Let's start with the hyaluronic acid. It is by far the most common filler that's used today. It is something that is not rejected by the body because our bodies make hyaluronic acid. That's the gel inside your eyeballs, it's the gel inside your joints, it's actually in your skin. So it comes across as being something that's naturally there. Your body also makes hyaluronidase, which is an enzyme that slowly over time breaks down that hyaluronic acid. The beauty of hyaluronic acid fillers is that if you, for some reason, just decide you don't like it, I can use an injected hyaluronidase, and within minutes, that filler is gone. So that is the safest of all of the fillers, and that's the only one that you can get rid of immediately if you don't like it. So very, very safe though, and it typically lasts about 6 to 12 months in most individuals. So with hyaluronic acid, you can see that was our patient that we talked about earlier. She has this beautiful curvature, which is called your OG curve, and it's a beautiful curvature of her cheek, which this is a sign of youth. Again, you can see that this contouring that's beautiful. This is utilizing hyaluronic acid in the lips to give you a very natural lip look and also smoothing out these lines. And here's another example of using hyaluronic acid, again in the smile lines and in the marionette lines to just kind of smooth it out and give you a little more rested, natural look. Here it is used in the lips. And I will tell you that most patients come in and say, I don't want you to touch my lips because I don't want to look like a duck. I hear that daily. And I promise everyone, I'm not going to let you look like a duck. If you see a duck, I didn't do it. You can just put a very little bit of hyaluronic acid in there. Hyaluronic acid in there to give you a nice, fuller, but more youthful looking lip without giving you a duck lip. So as you can see, this is a perfect example. Right here on the lower lip, this patient has developed a crease. That's because of loss of volume over time. By putting a little bit of hyaluronic acid in there, you get rid of that crease. Putting a little bit up here, you recreate the definition of the upper lip. And you also stretch out these lip lines or the smoker's lines that we all get regardless of the fact of whether you smoked or not. Everybody gets those lines. So by putting a little bit of filler in there, it stretches out those lip lines and smooths it out, giving you a nice, natural look without looking fake. Here are just some other examples. And a lot of my patients get a much thinner lip over time, and that's because of volume loss over your lifetime. And you can see that you can really recreate a very natural look without giving it a ducky look. We can also recreate the shape of a nose with hyaluronic acid. And this patient did not like the slight hump in her nose. So she asked me if I could make it straighter. And you can see you can recreate it nicely. And she was thrilled. Let's talk about calcium hydroxyl acetate, which is Radiesse. Radiesse is, it's not hyaluronic acid, so you cannot get rid of it immediately if you wanted to. You can get rid of a portion of it by injecting the hyaluronidase. It helps to break it up, but it doesn't get rid of it completely. This is a nice filler that has a lot of lift. It also causes a collagen formation, so it stimulates collagen formation over a few months as after you inject it. So I will show you an example of somebody who's had it in here. It's really a robust filler. So for people who have heavier skin and really need a lot of lift, it's the perfect filler for them. She didn't have a lot of longevity. She didn't feel with the hyaluronic acid filler, so we used the Radiesse in her and felt that gave her a better result. So really we have to work together to get the desired result that you want. This patient is emblematic of what I love to do. I love to mix the hyaluronic acid with the Radiesse. With the Radiesse, you get that lift that I talked about, but it's not necessarily as smooth as the hyaluronic acid is. With the hyaluronic acid, you get that smoothness, but not as much lift. So for about 3 years now, I've been marrying the two together, the hyaluronic acid and the Radiesse, and you get the benefits of both of them and a really nice, natural, beautiful lift. So she has heavier cheeks, heavier, thicker skin. And so just by doing a hyaluronic acid, I'm not going to get the lift that I really, really am searching for and she's searching for. So I mixed the two together and really was able to elevate that cheek. And as you can see, this is a good example of where we go from sad to happy and more well-defined. So she's thrilled. It also gives her a thinner appearance. And so she was, thrilled with that result. I use that a lot. I've done it on hundreds of patients, and I can't think of a single patient in whom I've used that combination that hasn't come back a year or so later asking for the repeat of the exact same thing. Sculptra is unique in the filler category because it does not give you instant gratification as the others have that I've shown you today. Sculptra is made with a suture material that we stopped using in dermatologic surgery years ago because we found it was causing too much scar tissue formation. So some brilliant person had the idea, let's pulverize this material. And scars are nothing more than collagen. So if you pulverize the material, put it into the tissue, we'll form collagen clusters around those particles. Well, indeed, that is what happened. And so it gives you a very natural look, does not give you the definition of the other two fillers we've talked about today, but it does give you overall volumization, which is great for that person who really wants a very natural look, slowly over time, but does not want to look like they've been done. It does last longer in most of my patients. I will do an initial treatment of 1 vial on each side. We repeat that in a month. Sometimes we have to repeat that 1 more time to give you your base. And then once a year, we just do 1 vial on each side, kind of as maintenance, and it works beautifully that way. So here's an example of a patient who felt like she looked tired, and we did the Sculptra, and it gives her just a really natural, more rested look. This woman in her 90s, believe it or not, again, just Sculptra gives her a very natural, rested look. But in addition, she's a great example of how it gives you what we call a Sculptra glow. You can see her skin texture looks better, and that really is felt to be because of the overall collagen, increase in collagen production. So she actually, she said, oh, I don't know why I'm doing this, but anyway, she comes back and she loves it. So, and she's a delightful woman. Anyway, this is myself, a picture of myself. This is in 2012, and this is prior to me doing anything. So this is after I've done Sculptra. And you can see that it just has given me overall volume. I also have put a little bit of filler in my cheeks to give me that nice reflection of the light off of the cheeks. And so you go from looking tired to more rested in this picture too. Now let's turn the tables and talk about the neurotoxins, also called neuromodulators. Some of the most common one, the most common one that you probably have heard of is either Botox or Dysport. Xeomin and Jeuveau are newer ones on the market. They are extremely safe, especially when they're injected appropriately in the right location, within the right level of the muscle. So very safe, and to be honest with you, they've been around for decades. So I'm very friendly with the Carruthers, who are the 2 people who created the use of Botox as it is today. Jean Carruthers, is an oculoplastic surgeon. Her husband is a dermatologist, and they began experimenting on each other about 30 years ago, and now, and look what's happened since. So very, very safe medication to use. This, Angelina and Brad, I'm going to show you, demonstrate where we typically inject this. For the frontalis muscle, which are the lines that go across your forehead, I usually inject not below this area, the midline, because you don't want to get dropping of the eyebrow. You need your frontalis muscle in order to keep your eyebrow elevated. So when you get that drop, you've heard reports of people having dropped eyebrows. That's usually because either too much neurotoxin has been put in there, or it's been put in the wrong location. So you really want to be careful of that. You can soften that and almost make those lines go away completely. Put it in here for your corrugator and your procerus muscle. That's to get rid of the 11s. She obviously doesn't have that in this picture. I'm only using it for a demonstration. But Brad has that folding of the tissue in the center in the glabella region. So that's where we would inject him. And I do inject a lot of men. So that's one question I get, is this just for women only? Absolutely not. I inject men with filler, I inject men with neuromodulators, and I treat men with lasers. So why not? Everybody feels better, so why not? Now, there are bunny lines here. I put the neuromodulator there. If people smile and I don't like all the lines on the side of their nose, I can soften these lines. Can't make these crow's feet completely go away, but by putting the neuromodulator here, I can actually give you a little lift of your brow to make your eye open up a little bit more. I love to do it down in here. Your mentalis muscle over time becomes more obvious because of that loss of layer of fat underneath the skin. So you get dimpling in the chin, and by putting a little neuromodulator there, that smooths out completely. And then we have a depressor anguli oris muscle that pulls down here, helping to contribute to the marionette lines. And by putting a little bit of neuromodulator in there, it helps to stop that pulling down. Here's a great example of a patient of mine where you can see those are resting lines. She's not even trying to raise her eyebrows. Those are resting lines. And so we can actually make those really almost virtually disappear. And you can see these lines around here have really softened significantly. So let's move beyond the fillers and the neuromodulators. We're moving beyond facial sculpting, and we're going to discuss taking care of your skin. As I already said earlier, a good diet, healthy food, a plant-based diet is ideal, exercise, and good at-home skincare regimen is really preferred. Intermingle that with in-office treatments, usually on a monthly basis for some patients who want to really maintain the health of their skin. And then we're going to discuss those in a second. I do want to just point out that we've just recently discovered that just like we have a circadian rhythm that makes us go to sleep at night and wake up in the morning, your skin also has a circadian rhythm. So it's wise to use antioxidants and sun protection in the morning, and DNA repair enzymes, retinoids, and peptides at night, so that overnight, while you're recharging your own battery, your skin is recharging itself as well. One of the in-office treatments that is the most popular in our office, and patients usually do this on about a monthly basis, is the hydrofacial. It's a 4-step process that is unlike any facial that you've probably heard of in the past. It's not just putting on a bunch of creams and solutions. What it is it's a machine-driven facial. And it's a 4-step process where it's an infusion of acids to open up the pores, followed by a mild debridement of the top layers of the tissue to remove dead skin cells, followed then by a vacuum process to remove all of the debris that's in those pores that have now been opened up, and followed by that in the final stage of an infusion of antioxidants or botanicals or whatever your skin needs. So it's a beautiful process. Your skin feels nice and fresh, and there's no downtime to it. Another wonderful treatment that has been around for a while, and it just keeps getting better and better, is microneedling. Microneedling is making little tiny perforations into the tissue, and that creates little tiny wounds. Your body perceives those wounds and says, wait a minute, I have to help heal it. And the way you heal a wound is by creating new collagen. So you're creating new collagen, and that's a wonderful way to get rid of the fine, or at least improve the fine lines, particularly around the mouth. And it's also good for acne scarring. I mentioned PRP because PRP is a new addition to the microneedling that is fabulous to help really stimulate collagen growth. PRP stands for platelet-rich plasma. And it contains 7 growth factors that really stimulate the blood flow, which improves healing. And it also stimulates cellular turnover. So you're producing new collagen, and this is like a boost to create new collagen in your tissue. It's particularly useful during microneedling because you've now made little tiny perforations into your tissue, and you now allow that PRP to sink down into those little perforations and really tell your skin, come on, let's get going, let's make this new collagen. It's also great for halo, and we're going to talk about that in a moment, and laser treatments to really help calm down the skin after the procedure and rev up that repair cycle. We're also using it for hair loss. It's injecting into those areas of hair loss, and I'll show you that in a moment. To stimulate hair growth, and that we've had wonderful results with that as well. This is an example of me having my blood drawn for the PRP. We take 1 vial of blood, spin it down, and remove the top layer of the blood, and so it's the yellow portion here, and we're injecting it into my scalp, but I do this in patients all the time, and with great results, like I said. The halo is perhaps the most popular procedure we have in my office. It's a little bit more aggressive than the treatments that my esthetician does, which are the ones we just showed. The microneedling is an esthetician treatment, as is the hydrofacial. But the halo is a laser treatment. So we're going to move into the lasers now. And the halo is a 2 laser treatment. It is fractionated, which means you're not covering the entire skin, you're covering portions of the tissue, and that's intended to be that way. We make little tiny perforations into the top layer of the skin, and down deeper into the dermis, we make little heated channels. Those heated channels are perceived by your cells as wounds, and your body creates new collagen as a repair mechanism for those little heated channels for those wounds. So the halo is kind of like the microneedling on steroids, but it goes much deeper, and it's a much more aggressive treatment. But the beauty of it is that it only has a very short downtime of usually less than a week. It's similar to what you've heard of as Fraxel, but Fraxel has a longer downtime because you don't have the little tiny perforations in the surface of the skin to allow those channels of dead tissue that have been created from the heated channels an escape route. So now those have an escape route by going out of the surface rather than your body having to absorb them, which was what the downtime was with Fraxel. So halo has a lower downtime and a great effectiveness. But because you have those little channels in the surface of your skin, it's a great opportunity to put PRP on and let that sink down into those channels and perforations. So this is just an example of a patient who's had halo. It's wonderful for fine lines, for evening the texture, for decreasing the pore size, for decreasing the pore count, and for stimulating collagen growth. And this is an example of me having halo before, and this is a week after. And these are the stages I went through on a daily basis to get to the end result. You continue to see benefit from it for about 6 months as your collagen is continuing to turn over over that whole course of 6 months. So you get a delayed and continued improvement in this texture and tone of your skin. But you can see that at the beginning, this is right immediately after the procedure. I had it in combination with another laser procedure that I'm going to talk about in a minute, called BBL, that helps to get rid of pigments and underlying red. But so I get swollen around the eyes in particular the day after, and then that swelling starts to move down into the jawline. So by the end of the week, it's pretty much back to normal. And believe it or not, you can actually put your makeup on day 2. Some other light-based therapies. Basically, what is light-based therapy? It's using the power of really intense light to affect the skin. And there are 2 main types, the laser, which is what the halo was, and there's also broadband light. Lasers have one single target in the tissue. So it's either water or color. So some lasers are great for vascular growths because they seek red. Some lasers are great for pigmented lesions because they seek brown. And then other lasers like the CO2 laser seek water in the tissue. So it really depends on what that one target is. And you tailor your laser choice by what you want to treat. And then the IPL or broadband light, same thing. IPL, broadband light, they're the same, synonymous. Is a broad spectrum of intense light that treats many different things at the same time. So what can light treat? It can treat browns, it can treat reds, it can treat wrinkles and fine lines, it can treat texture and enlarged pores, and it can get rid of hair that you do not want. Here's an example of the BBL, really reducing the pigmentation, but also increasing the quality of her skin, as you can see here. Really increasing the quality of her skin by stimulating collagen. I know that we keep talking about collagen stimulation, but micro injuries to the tissue are what result in new collagen formation. And that is key to maintaining the texture, tone, and beauty of your skin. So here's a nice example of this patient had 3 BBL treatments. We're also going to talk about ProFractional therapy. It's the same type of thing. It's a laser, but it's fractionated, so we get little channels. Again, we're talking similar discussion as what we talked about with the halo, as what we talked about with the microneedling. It's just different uses of different devices depending on what you're trying to treat and what downtime the patient has. So this is an example of using that ProFractional for acne scarring to really improve the texture of her skin. And here's in combination using the BBL and the ProFractional to really improve the integrity of her skin, but also obviously improve the pigmentation. One other laser that we're going to discuss is removing the surface of the skin. We talked about the ProFractional, in which case we had those little channels. Well, we can also ablate the entire surface of the skin for more aggressive treatments. And here's an example of using it in combination. I used the micro laser peel to go around these shingles scars to flatten them around the edge. And then I used the ProFractional to go into the scar itself and stimulate collagen production, actually helping to raise up those indentations and flatten the raised areas so that you can see she gets a really nice result and no obvious shingles post-herpetic signs. This is using the surface micro laser peel, which is in a very thin layer, removing the very surface of her tissue, but also doing the BBL to get rid of a lot of that pigmentation. and underlying redness, and obviously giving her a much better skin tone and texture. We can also use the ProFractional and micro laser peel to help minimize those lines around the lips. And when we need deeper, more aggressive treatment for those really deep smoker's lines, we do a deeper, more aggressive resurfacing of the whole tissue so that we can actually improve this area, and get a nice refreshment of the skin. So the overall goal in facial sculpting and in lasers is to give you a nice, more relaxed, refreshed look. And that's what people want. Most of my patients, if they come to my practice, they've heard that I give them a natural look, and that's the goal. I don't want to make you look like somebody else. I won't make you look like somebody else because I think that that's got a whole other psychological level to it that we don't need to discuss here. That's another talk. But I want you to look refreshed. I want you to feel great about yourself. And that is the goal. The rejuvenated, healthy, I feel really good. I had a great night's sleep. I feel good about me. That's what we're aiming for. And you can see that you can get that look with simple intervention that's non-surgical. So I really appreciate the time you've given me. I don't take it for granted, and I encourage you to call me if you have any questions. My website is yhderm.com, and I am happy to be of assistance to you. Thank you.
Thank you so much, Dr. Yag-Howard, for taking time out of your busy schedule to be with us. That was incredibly informative. And I also wanted to mention, which I forgot to do in my introduction, that Dr. Yag-Howard is also going to be the incoming Vice President of the National Women's Dermatological Society. So again, thank you so much, Dr. Yag-Howard.